Hello, I'm Dr. Barry Pecos, York Region's Medical Officer of Health. I'm here to answer some of the questions we're getting from parents right now about COVID-19 vaccines for children. Should I get my child vaccinated? The answer is yes. This is the most important thing you can do to help your child return and stay in in-person learning at school. Vaccination protects your child from COVID-19 infection and from severe illness. While severe illness is rare, long COVID and multisystem inflammatory syndrome in children, or MISC, have occurred in Ontario, and vaccination protects children against these outcomes. More than half of children aged 5 to 11 living in York Region are now vaccinated. When everyone in school is vaccinated, the risks to your child and their schoolmates are dramatically decreased, and they'll be able to stay in school and get together with friends more safely. Is it hard to get an appointment for my child in York Region? Not at all. Our clinics accept walk-ins for children 5 years of age or older for their first and second dose. We want to make it as easy and as convenient as possible because we know how important this is. If you'd rather make an appointment, you can do that on our website at york.ca/COVID-19 vaccine. We have many appointments available. Does my child have to wait the 8 weeks to get their second dose? No, this is a really important question. The provincial program and the National Advisory Committee on Immunization, or NACI, has recommended 8 weeks between first and second doses. And there is some evidence that longer intervals between doses provides longer lasting protection than a shorter interval. However, there are many reasons why parents may want to choose to have their child vaccinated with a second dose earlier rather than later. They may want them to return to school fully vaccinated, especially as cases of Omicron peak, or they may want them to be fully vaccinated for travel or other reasons. Parents can decide to get their children's second dose as early as 21 days or 3 weeks after their first dose. And as mentioned earlier, you can walk into any of our clinics for second doses. Appointments are available but are not required. Does my child need a vaccine if they've already had COVID-19? Absolutely. They should get vaccinated even if they've had COVID-19 at any time. The protection provided by the vaccine is better and longer lasting than the temporary immunity from natural infection. After infection, a child or adult can get vaccinated as soon as they're feeling well and they're out of isolation. There is some evidence that waiting 30 days between infection and vaccination provides longer lasting protection, but with the surge in cases right now, it's probably best to get the vaccine as soon as they're out of isolation. What side effects should I expect? Most kids, including my own, didn't experience anything more than a sore arm following the COVID-19 vaccine. And in fact, side effects are much more rare among children than among adults. Some may feel a bit off, a bit tired, or rarely have a low-grade fever. Serious reactions are very, very rare. Please visit york.ca/COVID-19 vaccine for clinic locations and get vaccinated as soon as you can.